Make sure that you're rolling both the inside and the outside of your calf.
Nancy Howes watches closely, talking her patient through the first part of a physical therapy session.
A little bit more on the inside, so again 8 to 10 of them, and then I'll have you kind of rotate so that you're on the outside of the leg and do 8 to 10 there too.
Kait Harbour is on the other end of the video call. She's working on rehabbing her ACL and taking advantage of new virtual physical therapy sessions offered by Henry Ford Health System. An injury on the slopes landed Kait in surgery right at the beginning of the COVID-19 pandemic.
I worried, one, is it a crazy idea to have knee surgery when I knew the numbers were just going to continue to increase in the US and we were going to have shutdowns and things were going to look much different.
Some of Henry Ford's clinics did shut down during the outbreak, but not all, because orthopedic patients like Kait can't fully recover without physical therapy. David Tomzich is the director of sports rehab for Henry Ford.
It's crucial early on that a patient, that their range of motion returns at an appropriate rate. If the joint gets stiff, we have problems.
He says the virtual visits are keeping patients who are concerned about going out during the pandemic on the road to recovery.
So this provided an outlet where they could still receive their care, good care, and not have to take a risk for their health.
Therapists like Nancy can still get eyes on their patients.
I would rather you feel it there than in like the front of the knee where the incision is.
And patients can see exactly what she wants them to do. If they have equipment at home, she uses it. If they don't, she finds a creative solution.
If it's for a lower extremity, we will work on doing squats and calf raises and things that are more body weight. For an upper extremity, we can use the ground as a resistance, or we can just do some active range of motion exercises.
Kait, an avid athlete, admits she wasn't sure she'd get the workout she needed without seeing Nancy face to face. It only took one session to learn virtual doesn't equal easy.
I was sweaty, I was shaky. Afterwards, I hooked up my ice machine right away and I was like, that was no joke.
Kait tells me she'll consider using the virtual visits post-COVID-19 because they fit so conveniently into her schedule. Physical therapists tell me there's no limit to the type of injury they can treat remotely. They've seen patients with everything from foot to neck injuries. For Henry Ford Health System News, I'm Dana J.